Hi, and thanks for listening to At Ease, the military podcast of Thomas Nelson Community College. I'm Gary Pounder. Today's topic, retirement. Now, for those of us who were career military, retirement happens at least twice, maybe three times. The first time comes when you hang up the uniform, usually in your late 80s, with plenty of time to embark on a second or even a third career. But on this edition of At Ease, we're going to be talking about traditional retirement, if there is such a thing in this day and age. You know, that's the point when you stop working for good and start doing all those things you've always wanted to do, like travel, hobbies, more time with the kids or grandkids, or maybe spending less time with them, depending on your circumstances. Of course, reaching that point requires some fiscal planning, and for most of us, one leg of our financial stool is going to be Social Security. And as the American population gets older, there are a lot of questions about the program. For example, is security going to be there for me? What is the right age to begin taking benefits? And who qualifies for extra credits based on their military service? Well, to answer those questions and many, many more, we're going to be joined by an expert. Lizna Odhawani is the Social Security Administration Public Affairs Specialist for many cities. She's been working for the agency over 20 years and previously served in capacities like a bilingual claims specialist in the Dallas office. She's also worked for Social Security in Houston and Atlanta before transferring here to Virginia. She's won numerous awards for her work, and she routinely hosts workshops and information sessions for the Armed Forces community. So, everything you wanted to know about Social Security and the military, all coming up today on At Ease. But first, a question for all the airmen and Space Force guardians in the audience. Have you finished your associate degree with the Community College of the Air Force? Well, if not, what's stopping you? Well, I years back and found the biggest barrier to graduation wasn't long work hours or deployments or anything like that. It's the 5 general education classes at a civilian college or university that all CCAF students must complete to finish their degree. And that's where we come in. Thomas Nelson is one of the newest members of the CCAF GEM program, which makes us a preferred provider, if you will, of those general education classes. We have class options in each of the 5 categories. You can choose from in-person, hybrid, or completely online learning, and you'll receive a tuition discount no matter where you're stationed in the Air Force or the Make 2022 the year you finally finish your CCAF. Learn more by contacting the military team here at TNCC. Our phone number is 757-825-2938, or visit the website tncc.edu/GEM. That's GEM. Hey, it's closer than you think at Thomas Nelson, becoming Virginia Peninsula Community College. And once again, our topic today on At Ease is retirement. And in retirement, we're going to be talking about, again, one of those important legs on your financial stool, that being Social Security. And joining us again is an expert. Her name is Lizna Odhawani. She is the Public Affairs Officer for the Social Security Administration for a number of localities here in Virginia, and she's an expert in Security Administration for a number of localities here in Virginia, and she's an expert in all matters relating to Social Security, and she does a lot of presentations for members of the military community, so she has, let's say, particular expertise in Social Security and the military. Liz, thank you so much for taking time to join us here on the podcast.
Thank you.
First thing we're going to cover here, and this is something we hear every time Social Security comes up as a topic. We hear these horror stories that the trust fund is going to go dry at some point. The benefits may not be there for future generations. What is the position now of the Social Security Administration? How solvent is the trust fund? And will the benefits be there for folks like me who are getting close to retirement and folks who may be a few years, a few decades away from reaching retirement age?
Yes. Well, that's a great question. Social Security at this point.
Age.
Yes. Well, that's a great question. Social Security at this point, there are many projected dates, right? Every year you hear something new, 2035, 2037, even 2057. But that's if no changes are made, right? And it's 78 cents to the dollar when it comes to Social Security benefits. However, I don't know if you're aware, but in 2016, a lot of changes were made so that we could keep Social Security solvent. So there's been changes throughout many years. Many presidents make different changes so that they can keep Social Security solvent. Going back to 40 years ago, where everybody used to file for benefits at 65, get their Medicare, get their Social Security check. But now it's increased, or 40 years ago was updated. If you were born in the mid 1950s, it's 66 and either 2, 4, 6, 8, or 10 months, depending on when in the 1950s you were born. And then just myself, possibly you, your full retirement age is 67. So that, it does change over time. They do a new report every year, and all these changes are also on our website as well with the projective dates. But again, in 2016, a couple of things happened. One thing that happened was file and suspend. Again, you don't hear about this in at-large news media because not everybody knows about it. These types of changes, it doesn't affect everybody. But file and suspend was for people that were filing for benefits at full retirement, the same application suspending it. Now, why would you do that? Why would you file and suspend, right? Well, just don't take it if you're not ready to take it, right?
Sure.
Well, what a lot of people would do is they had spouses, right? I'm sure you're aware that Social Security not only pays you, but also pays for your family, right? Family
Absolutely.
benefits. Well, they might have a spouse or minor children or a disabled adult child that could qualify for benefits off of their record. Maybe they're not ready to take it because they want to wait. The more you wait, the higher you receive. But they might have a family member that's ready to take it. Well, you can't do that anymore. In 2016, they closed that loophole. If you're not drawing benefits, nobody's drawing benefits. So that's one way to keep Social Security going. They could increase the Social Security tax that's being, taken and matched by your employer. Every time you're working, you're paying a FICA tax or a Social Security tax. FICA stands for Federal Insurance Contributions Act. And if you're military, your leave and earning statement also Contributions Act. And if you're military, your leave and earning statement also reflects that. And it's a 7.65% tax that's taxed every paycheck and so it's a percentage. The more you put in, the more you get. It's not a dollar amount. So again, that could possibly change. They're talking about that. Full retirement age could change again, but another thing that they've done is deemed spouse filing. Again, as I mentioned, not only could you get benefits, but your family members can get benefits. So if you have a spouse that wants to file for benefits off of your record, and they've turned 62 after 2016, they cannot, just go ahead and take your benefit. They have to file for benefits off of their own record if they qualify, and then they could get benefits off of their spouse's record. So they can't not take their own benefit and wait. So a lot of loopholes, a lot of things have been closed. It changes.
Absolutely. So, yeah. Let me follow up on one point you raised there just a moment ago, Liz, about spouses. And certainly, we have a number of military spouses in our audience out there, about them being able to file on their spouse's benefits. Now, if I understood you correctly, when they reach retirement age, they must first file on their own benefits before they can file on their spouse's benefits. Is that correct?
Yes, if their spouse is still living, and their spouses, of course, if their spouse is already drawing benefits, then what we do is we compare what your benefits would be at full retirement age and what their benefit. We compare the two rates at what it would be at full age, which could be between the ages of 66 and 67, right? Depending on the year you were born. If your benefit is less than half of theirs, again, Social Security was passed over 87 years ago. During FDR's time, the New Deal, the Great Depression. So help people get out of poverty. So again, that one Social Security check that you earned and paid into wasn't enough for you and your spouse. So that's when they open it up to family benefits. And that's where you got spousal benefits, right? Now, fast forward 87 years, that's not the case anymore. You have two people in the household working. But that's not the case anymore. You have two people in the household working. Both people could be serving in the military. So times have changed. So what they do is they compare what your benefit is going to be at your full age and what their benefit would be at full age, your spouse who's living. And then if they're already drawing benefits, then you can go ahead and see if you could get a higher amount off of this. Then you can go ahead and see if you could get a higher amount off of theirs. So yes, but it has to be more than half of yours. You could be 62. If you wait until your own full retirement age, if you're going to wait until you're 66 or 67, you do have to go ahead and anytime you take it and you were if you turn 62 after 2016, the year of 2016, then yes, you do have to go ahead and take your own benefit first and then see if you could get anything extra from a spouse that's living, whether they're still your spouse or a divorced spouse. Now, divorced spouses qualify if yours to that person. So even if you were sick of them and separated half the time, it doesn't matter. If you are a divorced spouse, you have to show proof of marriage, which would be on your divorce decree of at least 10 years. And then again, if you are a widow, you don't have to wait till you're 62. You could actually file as early as 60. Divorce.
Question on this spouse issue: does the spouse who's going to be, or the partner who's going to be drawing off of their spouse, does the spouse have to be drawing Social Security for their spouse, wife, partner, husband, whatever, to draw off them and get the increase, benefit?
You mean the person that they're drawing from? Would they have to be?
Yes. Will they have to already be retired and drawing Social Security benefits?
If you're still married, yes.
Okay.
But if you are divorced from them, then no. You would qualify as an independently entitled divorce from them, then no. You would qualify as an independently entitled divorced spouse. As long as you're 62 and they're 62. If you married somebody younger, you do have to wait until they turn 62. But as long as they're 62 and you could get a higher amount off of their record, then yes. As long as if you are not divorced and you're still married, even if you're separated, you do have to wait until they file. Mm-hmm.
Now, kind of a related question on that, looking back over the history of Social Security and how the military has been impacted and factored into the system and everything. I know at one point, going back literally, I guess before I was born, because the military wasn't making a lot of money back in those days, that, correct me if I'm wrong, there was a period when the military was not paying into Social Security, but getting credit for their military service, correct?
It looks like you're talking about from 1957 to 1960. It looks like you're talking about from 1957 to 1967 or prior to that.
I think it was probably prior to 57, and then I think in the later period, and again, you're the expert, so correct me if I'm wrong, and I usually am, but from 57 to 67, military members were paying into the system, but again, they were receiving some extra credit for their military service so that they would be able to receive, for lack of a better word, a normal or full Social Security benefit once disabled. So talk about that for a bit and how those extra credits work and how they factor into a military member's benefit.
Yeah. So if you were in the active duty, between the ages from 1957 up until 2001, active duty 57 up until 2001, for every 3 months, every quarter you served in the military. So whatever you've made, while you were in the military, that's factored in, right? That's on your leave and earning statement. So that's there. That should reflect on your Social Security statement. So definitely want everybody on Let's Listening. So definitely want everybody on Let's Listening to definitely create your My Social Security account. And this is great for your students, for Thomas Nelson students, all the way up until you're closer to retirement age. I mean, I haven't my Social Security account yet, and I have a long ways to go. But the reason that I encourage every account is because we used to mail these out every year, right? Every year you used to get a statement in the mail letting you know how much you worked and put into Social Security. Now, we stopped mailing those out because of identity theft, but it is important to track it because while you're in the military, you do work and pay into Social Security, right? And you definitely want to go ahead and make sure you get credit up until 2001. If you're active duty, for every 3 months, you get an extra $300 averaged in. So if you are active duty for an entire year, you're looking at 4 quarters times 3, which is $1,200. So you're looking at an additional $1,200 averaged into your Social Security amount, what you're going to receive. So that's definitely important to make sure that you have your leave and earning statements, your W-2s, whatever it is that you get where you're filing taxes. You definitely want to go ahead and make sure that you have that. Even if it's going back 20 years. I heard something, even if it's going back 20 years. I heard something like you could only do it within 2 years or 3 years. That's not the case. Even if you served over 20 years ago, you have your W-2 or any proof that, that you've earned this much and paid this much into Social Security, we can go ahead and update your system, especially if you were active duty from 1968 to 2001. We should have that automatically in our system. If you were active duty between 1957 and 1967, definitely you want to make sure you can get a copy of your DD-214 from the VA, because we do interface with the VA, but you want a copy of that Social Security.
So just to recap here, Liz, if you were on active duty from 68 up until 2001, with a period that includes your humble host here, the additional credit should have been done automatically, but still a good idea to go back, get the W-2s for the period you served. Get the W-2s for the period you served in, whether it was 4, 10, 20, 30 years or whatever, and see how much was being withheld for Social Security, and making sure, I guess, that additional credit is in there as well. And I guess if folks have questions, did the additional credits based on my military service, is it reflected in my record, they can certainly contact the Social Security Administration.
Yes. So what happens is when we figure out your retirement application or your amount, so what happens is for the years that you were active, we're adding in an additional $300 to $1,200, depending on how many quarters you were active duty, to that average. So when we're, when we're trying to figure out indexing your earnings and all of that, we're actually adding that extra $300 to $1,200 for those years. With Social Security, if you don't have your DD-214, but we usually do interface with the VA, and we do have that. Absolutely. Excellent
points there. Now, we can also talk about other things relating to the military in terms of Social Security. I know that you do a lot of presentations. You do a lot of talk. Talks and information sessions with military audiences talking about the program. What are some of the most important points that you try to stress and bring out when you're doing those types of information sessions?
Well, one thing we want, especially in this area, we definitely want to let everybody know that if you are trying to stay on your TRICARE, it is very important that you go ahead and you file for Medicare. If you're going to be on TRICARE for life, or you plan on getting on TRICARE for life, it is very important that you apply for your Medicare.
To apply for Social Security right away, say someone who's going to wait until they're age 70 to get the maximum benefit, but you still have to go ahead and apply for Medicare at age 65.
Yes, and that is a requirement that TRICARE has, because they want because they're going to become your secondary, right? When it comes to insurance, Medicare usually has 4 parts: A, B, C, D, and then if you go to another insurance place, they're going to give you all sorts of different plans. But A and B are your main 2 parts. Medicare Part A covers 80% of your hospital parts. Medicare Part A covers 80% of your hospital bills. And Medicare Part B covers 80% of your doctor's bills. So if you see a doctor that takes Medicare, then that's your Part B. And if you're in the hospital for more than 3 days, then their A is going to cover you. Now, TRICARE is going to serve as your C and D. So C, hospitals and doctors' bills, and then they also have a prescription drug plan already in place. So they're going to become your secondary, and they're going to help with your Part D, your prescription drugs. So that's very important to understand, because if you're not on Medicare, even if you're not ready to take checks yet, you're absolutely correct. You could even do 5 or 3 months after. So you have a 7-month window during your initial enrollment period that if you want to go ahead and file for Medicare, and again, you could call the offices to get your appointment done. Starting tomorrow, from 9 o'clock in the morning till 4 o'clock, our offices are going to resume walk-ins. So if you need to go into the office starting tomorrow, April the 7th, you can actually take care of that tomorrow as well.
And I'm glad you brought that up, because it's because of COVID and all the ramifications of the pandemic, Social Security offices around the country have actually been closed to face-to-face appointments, walk-in customers for I guess almost the last 2 years. So beginning, like you said, tomorrow, the 7th of April, Social Security offices are now seeing customers in local offices around the country.
Absolutely. But you want to make sure that if you can take care of business online or over the phone, try that, because the line is going to be like a roller coaster ride. The lines are going to be long. So you definitely don't, if you cannot be on that line, that's better during your initial enrollment period before you apply for your Social Security retirement check. And our website, www.ssa, or Social Security, however you want to do it, .gov, G-O-V. You want to make sure it's .gov, not .org or net or com or anything like that. It's .org or net or com or anything like that. It's www.ssa.gov, G-O-V, and you could do /Medicare. Or if you just go to our homepage, you'll see a Medicare link right there. And if you click on that, it'll take you right to the Medicare page. And you could even apply for it right there. So it'll save you some time, wait time, and some hassle if you can do it online. But definitely want to take care of that at least 3 months before you turn 65. And that's important even if you're married, because Medicare is not just for you. It could be for your spouse too, just like our benefits are. So if you're married, of course, they could do it off of their own record, or if they don't, then, they could file as a spouse and get Medicare off of your record. So that's important as well for people to understand.
Now, you mentioned on filing for Medicare, good idea to submit the paperwork, do it online if you can, 3 months before your 65th birthday. Let's say somebody is ready to start collecting their Social Security checks, their benefits. Again, do you recommend the same kind of window, applying 3 months in advance of when you would like to start receiving benefits?
Yeah, so what happens is when you start receiving your benefits, part of the questions, if you're turning 65 within the next 3 months or so, that's an automatic question that we're going to have with the benefit application. So that'll already be built in. And let's say you've already taken your benefits. Let's say you started your benefits at 62 or 63. At 65, you'll automatically get the Medicare cards in the mail. So you don't have to do a thing, just keep it. And I guess you would take it to your DEER's office or let your rep know on the military side that you're on Medicare and you're ready for TRICARE.
Okay.
So, yeah.
Very good information. Now, along with emphasizing the need for your 65th birthday, what are some of the other major topics you really like to cover with military audiences in talking about Social Security?
Well, another thing that would be good is the Wounded Warrior Project, right? So of course, we see a lot of military casualties as well. And Be Good is the Wounded Warrior Project, right? So of course, we see a lot of military casualties as well. And if that's the case, we do try to expedite those cases. We have to take into consideration if the person is going to be working somewhat or on light duty. And if that's the case, we do try to expedite those cases. We have to take into consideration if the person is going to be working somewhat or on light duty when it comes to because sometimes, you could still get payment, right? You still could get payment while you're in the military, or if something has happened, they usually contact us and we quickly take your appointment and we try to expedite those cases. When it comes to the wounded warriors. Also, if you have any service-connected disability, any type of condition that you're still dealing with when you're filing for your Social Security condition or something, so they could look into that as well.
Right.
If you're applying for benefits and your main primary place is the VA, you want to let the doctors know there that you're applying for disability, you're applying for benefits. So when we send out for your medical records, they could get that to us ASAP. They could get that to us ASAP. So that will help with expediting a decision as well. So anything military related, a disability, obviously casualty, and we would have to know more about that as well when it comes to working. If you're going light duty, or what the situation is at that time. So yeah.
Sure. On a related note, obviously many folks who suffer injuries, who suffer other disabling conditions in the line of duty, wind up receiving either some kind of medical pension, from the military, or they receive disability through the VA. How do you reconcile those type of payments with benefits they would get through Social Security?
Well, so for us, it doesn't really make a difference. With Social Security, you worked and you paid into it, right? With FICA. So we don't take into consideration what other benefits you're receiving. All we look at is if you're working. So if you're working, let's say that you were in the military, you were a veteran, or, you're still in the military. If you're working at $350 a month with your job, or let's say you're self-employed and you're working. So we look at only that. So if you're getting a VA check or any other type of disability service-connected check, it's not, it doesn't really, make a difference with Social Security as long as you paid into Social Security. It's the tax that's being taken out is Federal Insurance Contributions Act. The more you put in, the more you get. And, the 7.65%, like I said, it's your payroll tax. And then, of course, the government will match it. So instead of getting 7.65%, you're looking at a little bit over 15% when you're drawing it. So the more you work, the 15% when you're drawing it. So the more you work, the more you put in. So none of that really affects your Social Security, disability, or retirement check.
And a wounded warrior, a disabled veteran, they can actually start drawing early. They don't have to wait until age 62, or do they have to wait until the normal qualification ages for Social Security?
Well, if they're filing for Social Security disability, they're going to get Social Security. It's based on, what they worked and what they paid into.
Sure.
They're just going to get it early because they have a condition. That's the only difference. So, and once you turn full retirement age, it'll automatically change the title from disability to getting your retirement benefit at whatever it would have been at full age. So if you look at your statement, you'll notice that your retirement at full retirement age and your disability amount is going to be very similar. So you're pretty much drawing it early because you have a condition.
Understand.
Yeah.
And on that note, we've often heard stories, and this is often anecdotal, secondhand, that if you're applying for a disability payment through Social Security, that you're probably not going to get it the first time around. You probably need to hire a lawyer. It may take you 2 or 3 attempts to get your claim approved. Is there any kind of truth in those stories that we hear?
Well, so this is how that works. So what most people, you're absolutely right. I've heard the rumors as well. And the biggest thing I want to let people know is that you want to let us, sometimes people will think that, okay, well, Social Security already knows my condition. They already know what doctors I'm going to. It's in their system, right? Yes, we know where you've been working, right? Because that's what FICA tax is all about, right? It takes out when you're working and paying into Social Security. So we keep track of where you're working. Hence, you get the statement every year and future whenever you file. But when it comes to your doctors, your hospitals, your tests, we don't have any of that information. So during the first time around, people just assume that, we have all of this information. And this is why it's important, if you can file for disability benefits online, that helps you take your disability benefits online. That helps you take your time to do it. And we all recommend doing that, because if you are going through our office, you're going to speak with a rep, or you're going to do it on the phone. And, you only have an hour and a half, right? You might feel rushed. And you're going to assume that we already have this information, which we don't. So a lot of times people assume that they don't give us as much information, and then they get denied. Then by the time they file an appeal, you get 60 days to do your appeal. That's when most people will give us the information. So true, 50% of our cases do get denied the first time because of lack of information. So by the time people will start providing us everything we need, and then they'll get approved. So that's where that rumor is coming from. So I always tell people, you want to be proactive, not reactive. Let the doctors know, let the hospitals know you're filing, and you want to let us know as much information. The more information you provide, the sooner we could get a medical decision. Chances are you could be approved. But, the less information you provide, or assume that we already have it, then of course the longer it will take.
Sure. Now, let's say someone provides all the information required, and even though Social Security has a huge backlog of these disability claims, what is the normal timeline? What is the normal timeline for getting approved? Again, assuming that the applicant provides all the necessary information up front. Are we talking a period of months, a period of years, whatever?
Yeah, we're talking about 3 to 4 months on average, so about a 90 to 120 days on average. And again, if you provide the information, that's great, but you definitely want to let the doctors and hospitals know as well, because we still have to contact them. Our disability termination services, who we contract out to, they do have to still, they're meeting the 5 points of disability, right? That what we need. If this person is working, how much are they making? Is this, and another thing is, don't be shy. When you're filing for benefits, now is not the time to be embarrassed or be shy. You want to tell us everything. Maybe a combination of benefits will help meet that disability requirement. So if you have PTSD and back issues and, diabetes, high cholesterol, whatever you got going on, list it. Because you definitely don't know, maybe a combination of different conditions will help. But absolutely, it could take 3 to 4. It could take 3 to 4 months. I've seen cases come back within a week.
Wow.
But it all depends on if you've let the doctors know ahead of time and they're in the loop and they're able to go ahead and send us the information that we need. Disability Termination Services also has a bunch of partnerships where they can just get cases. Disability records electronically as well. But it depends on the person. The more information they provide, at least doctors, hospitals, tests, medical records, not medical records, even meds. And if they have medical records on hand, that's great. But we would never request you to get medical records, because you could possibly have to pay for it. And we would be the one that would cover that cost. So we would have you sign or attest stating that you give us permission to contact your doctors, authorization to get information, and then we would then go ahead or
provide as much medical information as you possibly can to support your claim, and also coordinate with your physicians, other healthcare providers, so that they can provide the additional information that Social Security needs to make a determination on your disability claim. And on this general topic while we're talking about it, differentiate between the SSDI, the disability program, and SSI, the supplemental security income program, because they are different programs and they're aimed at different groups.
Right. Well, it could be the same group. It just depends. But you're right. Supplemental security income is a need and paid into Social Security. We have over 2.6 million Americans that receive both Social Security and SSI, supplemental security income. So Social Security disability insurance is what you've worked, what you've paid into. You see it on your statement on the disability section, how much you're going to get if you file for disability, right? So similar to your retirement. Supplemental security income is based on need, as I mentioned. So even a child can get SSI. I see a lot of even NICU babies that are, going to be in the hospital for more than 30 days, low birth weight, or whatever the situation is, even they can get it. So supplemental security income is based on, supplemental security income is based on need. So we look at parents' income if a child is under the age of 18, because it is based on need, similar to food stamps and Section 8 and Medicaid and all of those types of needs-based programs. And then once a person turns 18, if they're disabled, they could qualify. But again, if they're married, we look at spouse's income, we look at their income. Once they turn 18, we no longer look at parents' income. So if you have a disability condition, but you weren't eligible through the supplemental security income program before 18, you could qualify, when you turn 18. And then also, when you turn 65, you don't have to have a condition per se at 65. You just have to be low income. So we see a lot of people that get a little bit of a retirement check and a little bit of an SSI, a supplemental security well. So it's really a supplemental program. It is based on needs, similar to the requirements of social services.
So generally speaking, for someone to qualify for SSI, you mentioned they have to be low income. What kind of an income threshold are we looking at?
Well, every household is different, but we're looking at maybe resources, like if you have an assets, or $3,000 if you're a couple, if you're married to somebody. So again, that's just an example, of a resource. Income-wise, you're only looking, the maximum SSI check an individual can get in 2022 is $841. So if you're getting something, if your SSI check an individual can get in 2022 is $841. So if you're getting something, if you're receiving a check of $1,000 from somewhere, if you're working, of course, there's, we do take that into consideration, earned income and unearned income. But a lot of people that were on an check of $1,000 from somewhere, if you're working, of course, there's, we do take that into consideration, earned income and unearned income. But a lot of people that were on unemployment, let's say, they might not qualify, or a lot of people that receive a VA check and their checks are more than $1,000 or a disability, then you're not going to be eligible. So it's very low income.
Kind of shifting gears here, something that, we hear a lot. There are all kinds of financial planning and discussion shows on TV and on radio, online. And one of the big questions that everybody is always, and I know it's an individual decision, but what is some of the advice that you give? Because I know you get this question when you go out and do information sessions or do webinars or what have you. How do you respond to that question when somebody asks, when would be the right age for me to start drawing my Social Security?
Usually, and I've been doing this 20 years, I usually say, well, how long do you plan on living, right? It depends on when you're going to, your break-even point, right? So, because you could take it as early as 62, right? And there's no benefit in waiting past 70, if you want to get delayed retirement credits, right? You could do that. But the thing is, it really depends on in your situation. Are you working? If you're taking it before full retirement age, you can't work and make as much as you like. The limit in 2022, and this limit goes up every year, is $19,500, or more than that, or more than $19,560. For every $2 you make over that, we withhold $1 from your check. So again, it depends. Are you working? It doesn't matter what your spouse is making because Social Security is very different than supplemental security income. It's based on what you worked and what you paid into, and if you're working now. So it doesn't matter about any other income, but just wages. So if that's the case, are you, it depends on you. If you're going to take it at full retirement age, again, that used to be 65, right? Now it's changed from 66, depending on the year that you were born. And then if you were born after 1960 and then if you were born after 1960 or after your full retirement age is 67, you're free to work and make as much as you want, right? And then for every year you wait past that, you get an 8% increase. And like I said, there's no benefit in waiting past 70 because the increase ends. So it kind of depends on his. But again, you also have to think about your break-even point, right? Let's say you're going to take it let's say you turn full retirement age at 66, and at 66 you're going to get $1,000, right? Versus 70. Okay, let's say you're thinking about taking it at 70, wait and get the maximum full delayed retirement quarter. 66 to 70 is 4 years. 8 times 4 is 32%, right? 8% increase for 4 years is 32%. So instead of getting $1,000, you're going to get $1,320. Sounds good, right?
Mm-hmm.
Might cover a Medicare payment. But the thing is, you've now given up $48,000. You've waited 4 years to get an extra $320, and you've given up $48,000 in that time frame, because that's $1,000 a month for 12 years, so that's 48 months, right? So so again, we don't really know when you want to take it, but how long do you have to live to break? When you want to take it, but how long do you have to live to break even? And on average, you're looking at about 13 to 14 years. So you'll have to live till you're 83 or 84 years old to get your your $48,000 back, right? So again, you tell me how long you plan on living, I'll tell you when to take your check.
When you think about that, and obviously, the unthinkable can happen. You can come down with a terrible disease, step in front of a bus, whatever, which we hope will never happen to anybody. But their rule of thumb nowadays, with advances in medical technology, medical science, and until recently, we were all living longer and up. The rule of thumb has always been expect to live longer versus dying sooner. And so that may be some good advice to think about when you're considering at what age do I want to go ahead and take my Social Security benefits. Now, other things for the military audience, other things you like to cover with them when you're talking to these armed forces audiences about Social Security.
Well, that's pretty much it, mostly. I mean, do you see anything on your end where you get questions? Questions on military?
We do from time to time. Again, we're not the experts on the program. We're primarily either current beneficiaries or folks like me are getting close to being beneficiaries out there. And I think one of the biggest concerns that many military have exactly when do I start taking my benefits? But what you mentioned there a moment ago, that is, let's say, for example, a retired military member getting a retirement check, they decide at whatever age they happen to be, somewhere a little bit past 62, tired of working, I want to go ahead and start, I want to keep working. So the point you brought up a moment ago, that during that period when you start taking your benefits up until what would have ordinarily been your full retirement age, you have to be very careful in terms of how much additional income you're bringing in. I think you said the limit's $19,000. Go over that.
$19,560.
Yeah, when you go over that level, then for every $2 in additional income above that, you're going to lose $1 in your monthly Social Security check.
Right. So that's one. You can't work and make as much as you like. That's true. If you're drawing disability, the limit is $1,350 a month. If you're trying to get Social Security disability, and if you're trying to draw retirement, it's $19,560 for the year, which is $1,630 a month in 2022. if you're working. Another thing, survivor benefits if you're working. Another thing, survivor benefits, right? That's huge. Survivor benefits is different because you could start that early as 60. You don't have to wait till you're 62 to get survivor benefits. And if you're a disabled widow, you could actually get it as early as 50. But you have to qualify for disability. Benefits is also something that we have to talk to when it comes to family members as well. Again, full age, full benefit, you could make as much as you like. So if you have a surviving spouse, you could draw the full amount, your deceased spouse's full amount at full retirement, at your full retirement age. But if you reduce it is 71.5%. So instead of, getting that 50, as I mentioned, if your spouse is living, you could get up to 50% of what they're getting. But, if your spouse has passed away, or an ex-spouse that you were married to for at least 10 years has passed away, then you would get the least you could get is 71.5%. It goes up for every year you wait, so it can go up to 100%. Now, the thing with survivor benefits that's different is that if you take benefits as a widow, you could wait and take, you could go ahead and wait and take yours later. So delayed retirement credit and take yours later. So delayed retirement credits, you could go ahead and switch over to yours later. Because again, you could start it as early as 60 and you can't start your own until 62, right? So if you were going to take it, let's say at full retirement age or prior to that, you could start the widow's benefit, and at full age, you could work and make as much as you like, and then benefit. And at full age, you could work and make as much as you like, and then you could get delayed retirement credits as well. Or you could just wait and let yours sit and get delayed retirement credits. And you could switch over to that as well. So if you want to get remarried, you can after 60. So, I mean, I don't know if you heard, but the cute little couple in the nursing home, right? I don't know if you heard, but the cute little couple in the nursing home, right? If they want to go ahead and, if they want to hang out, they can hang out all they want, but they're not getting married. Why? Because one of their exes is still living, and they're probably getting that extra benefit check from them. And they don't want to mess with that. However, if you're a survivor and you're being checked, again, divorced spouses could also qualify as long as they were married for 10 years. So that's fine. And a current spouse would qualify if they were married at the time of death. They would qualify as long as they were married for 2 years. We also have the lump sum death benefit for survivor, very big amount. I don't think that's changed since FDR passed the Social Security.
I think it's about $250 or something like that.
$255. It used to be $250, but they did go up $5. So $255 is the lump sum death benefit amount. Absolutely. But if there's no spouse in place, then it could be paid out. But if there's no spouse in place, then it could be paid out to children or even a disabled adult child. Another thing I wanted to touch base on is disabled adult children. Let's say you have a spouse that passed away and you have a child that is disabled, or a spouse that's going to receive retirement benefits or disability benefits, and you have a child that's disabled. That child can get benefits off of their parents' record as well, even as an adult. If that child if let's say they started receiving SSI benefits because we looked at parents' benefits, parents on need. So they qualified at 18, okay, because maybe they have a condition and they don't have any income or anything, so they qualify. All right, now they're 40. Dad or mom is 60, 62. Let's say they're looking at filing for retirement benefits, right? Maybe the child worked a little bit, some Social Security disability off of their record. Maybe they worked part-time, right? But now they're 40, and the parents are now in their 60s. So what happens? So what happens is that during the application process, we ask, do you have any children that are under the age of 18? Well, you're going to say, no, I don't have any minor children under the age of 18. Well, you're going to say, no, I don't have any minor children. All right, so do you have any children that are disabled before the age of 22? That could be a yes, right? Because you have a child that's still on SSI benefits or still on Social Security benefits, and they were declared disabled before the age of 22. Well, then that child can, before the age of 22. Well, then that child can now get benefits off of your record as a family benefit too. And even after you pass away, they will continue to get benefits as a survivor and possibly even Medicare off of your record. So that's another thing I wanted to address, because I do get some questions about disabled children. And going into adulthood as well, and how the parents, Social Security could help them. So, yeah.
More of our conversation with Lizna Odhawani in just a moment. Right now, though, a message for those of you leaving the service in the months ahead. How would you like to learn before you leave for that civilian job market, and at virtually no cost to you? I'm referring to the Skill Bridge Welding Training Program at Thomas Nelson. As the name indicates, it's part of the military Skill Bridge program, which allows transitioning personnel to spend up to 16 weeks in an education training program during their last 6 months on active duty. It's aimed at helping you acquire new skills and enhancing your employability in the civilian job market. The welding program at TNCC is only 5 weeks in length, and you can choose from morning, afternoon, or evening sessions. You'll earn a certificate in shielded metal, which can help you land a job as a welding trainee. And if you do well in the program, and most of our military students do very well, you'll be encouraged to apply for a welding trainee position with Newport News Shipbuilding, which offers great pay and benefits from day one. And best of all, the cost for the welding training program is paid for by Virginia and the TNCC Educational Foundation. Learn more by calling us on the military team at Thomas Nelson. Our phone number is 757-825-2938, or you can email me. That's PounderG, POUNDERG, at tncc.edu. We're at Thomas Nelson, becoming Virginia Peninsula Community College. Continuing our conversation now with Lizna Odhawani, Public Affairs Officer for the Social Security Administration here in Virginia. And we've been talking about do's and don'ts with the program. And Liz, I was just curious, your perspective, someone who's been working for the agency for a number of years now, what do you see as being perhaps the biggest mistakes that military-affiliated recipients often make in claiming their benefits? And what are some things they can do to potentially avoid those mistakes?
Okay. Well, the first thing, as addressed, if TRICARE for Life is involved, you definitely, if you're going to stay on TRICARE, from TRICARE, is it Prime to TRICARE for Life, definitely want to go ahead and sign up for Medicare at 65. Okay, so make sure you take care of that 3 months, even if you're not ready to take your regular Social Security check. So definitely www.ssa.gov/Medicare will even allow you to go ahead and take care of that online. And offices are open, so that's great. Monday to Friday, 9 to 4 for walk-in and appointments. But we do want everyone to understand that the lines are going to be long, as people are finding out. So definitely want to tell everybody that if you can do things online, do things online. Again, create your My Social, do things online. Again, create your My Social Security account. If you go to our homepage, www.ssa.gov, you'll see a link for my account, or you could do /my account. And if the biggest thing that people don't do now that we are not sending out, the Social Security statements, is to, make sure you look at your statement, make sure it's updated, because you want to make sure that when you get paid, it is paid correctly when you apply for your benefits. So you want to be proactive about that. Make sure you're on top of, what to us and what we actually have. And if there is something incorrect, get in touch with your employer, get the proper W-2, your leave and earning statement, get whatever from the military, and make sure that you have that in file. Make sure everything is correct and up to date. Also, if you lose your Social Security card and you need and they need their Social Security card, we see that all the time. If you lose it, you don't have to wait in line and come in and wait for your to bring in your driver's license or your state ID. You could actually do that request online as well. So if you lose your Social Security card, you need a replacement card, get that through your My Social Security account. So all you need to do is go to www.ssa.gov/my account, go under replacement documents once you're logged in, and you could get your Social Security card replaced. Okay, so that's huge. That saves you some time, right? Also, that receipt that you were getting, card, remember, it would come to you in the mail and you would get a receipt. Well, that receipt will now be emailed to you. So it's fairly quick and it does work. We have 61 or 62 million users with the My Social Security account, and it's growing every day. And Virginia, you can go ahead and use it if you have a valid driver's license. And Virginia, you can go ahead and use it if you have a valid driver's license or state ID even, and you could take care of that. And it has been highly successful. Also, you can, plan for your benefits, make sure that since everything is already housed online and you're thinking about applying for disability or retirement, you could apply for all disability or retirement. You could apply for all these benefits online, but we have 11 different calculators online too. So let's say you also, because a lot of our veterans actually, after they are discharged or after they're done with military, they get a job at the federal sector, right? And they were in the 80s and they were civil service retirement through the civil service retirement system. And they didn't pay into Social Security. So some of their jobs have Social Security, credits, and some of them don't. So we even have a calculator for our civil servants as well. And again, we know a lot of veterans get hired with the federal government. So, you want to definitely play with our 11 different calculators. You want to make sure you have your DD-214 and everything ready in case you are filing and you need to show proof of that. But usually we do have that automatically since we do interface with the VA as well. And if you're on benefits with the VA as well, and if you're on benefits and you need to update your address, your phone number, your direct deposit, get your proof of income letter, get your 1099 for taxes, get your Medicare card replaced. Like I said, even get your Social Security card replaced, whether you're on or not on benefits. You could get your benefit verification letter stating how much, your benefits will be, and you could take care of all of that online as well. You could always give us a call. We're still available on the phone Monday to Friday, 9 to 4. So you could call your local office to get a hold of your local office. You could go to www.ssa.gov/number and address. So you could call them during office hours. And like I said, today is reopening day. I know it's baseball grand opening and it's Social Security grand opening after 2 years. So we're battering up, and you can come in during our office hours as well. Most locations are available for walk-in service.
So we should point out that we've actually had to tape this podcast over a couple of days. We began yesterday, the day before the Social Security offices reopened. They're now reopening today on Thursday, the 7th of April, after being shut down for a prolonged period due to COVID-19. So again, that's a valuable resource for folks who need to communicate and deal with the Social Security Administration. But as you point out, the lines are going to be long. If you can do something online, and you can do a lot online. In fact, a good friend of mine just applied for his retirement benefits, and he was amazed at how easy and convenient it was to go online, apply for his benefits. And I think he wrapped up the entire application in about 15 or 20 minutes, and boom, it's done. No need to go visit an office, and, the check will start coming in at the time he designated. So, again, I've been on the website before. I've got my own Social Security account. It really is a valuable resource. And, I can only echo what you've been saying in the podcast about the convenience and flexibility of doing these various functions online. One more thing I want to touch on very briefly before we wrap up here. We have folks that they decide they're not quite ready for retirement. How does someone, for lack of a better term, unretire? In other words, suspend their benefits, get back in the workforce, work for a few more years, keep paying in the system, and then when they finally decide, now I'm ready to retire once and for all, then...
Sure. So what happens is if you're going to go back to work and it's been over a year since you filed, you cannot withdraw your benefits. You cannot terminate it. People could do that before. And what would happen is people would, stop their benefit. They would pay us everything back and then come back at 70, they would pay us everything back and then come back at 70 and do delayed retirement credits. And also, they've paid us back, or they've put in their money that they've already, paid us back, but they've put in that money that they already received and got a higher interest out of it somewhere else. So again, we stopped somewhere else. So again, we stopped doing that. So what happens is, if you want to go back to work or something, and it's been over a couple of years or over a year, if it's been over a year since you filed, you can suspend it. So you can request to suspend your benefits due to work, or if you want to just terminate it completely, withdraw your application, do that within a year. So within a year, you can still stop it and you could pay us back like it never happened. But if it's been over a year, you can go ahead and suspend it, work and pay into Social Security, and you'll get a higher amount, because the more you put in, the more you get. Absolutely.
All right. Terrific. Now, we should point out, too, that you audiences, in fact, I think you've got a nationwide webinar with the Navy coming up later on today. If there's a military group or organization out there that would like to have you conduct a webinar, an information session on Social Security, what is the best way for them to get in contact with you?
Sure. Well, we have on our website, you can request a speaker. So you can go under events and request a speaker. You could just Google public affairs specialist. So our titles are called public affairs specialists, and we're all over the country. So there's a few of us in Virginia. I cover the Tidewater area and a few other cities. And then there's a few in every state. So actually, if you want to get in touch with us, you could actually go into socialsecurity.gov and just search public affairs, or you could just Google Social Security public affairs and you'll get a list of all of us. We're all over the place, but absolutely you could contact your local office all over the place. But absolutely you could contact your local office and they will let us know that, hey, we have a request for a speaker, and you can go ahead and go that route as well. So then they'll get in touch with the local rep for you. So absolutely. And another thing I just want to point out, if we have any people from, because I know Tybee as well, but if you have anyone in Fort Lee listening, Petersburg area, want to point out that right now they are not, just Petersburg office is not available for in-person walk-ins right now. They are still doing appointments in person, but they're not available for walk-ins. So that's only, I think, 2 of our offices, because this is military, and Fort Lee is over there.
Sure.
So if you're trying to walk into Petersburg, you cannot. But all of the offices here, other than that, are available for walk-in service.
Now, for folks who might be in the Petersburg, Fort Lee area and just heard that they're not taking walk-ins right now, is there a projected date when you expect that office will take walk-ins again?
We do not know yet. They're going through some renovations and stuff, so it's just not safe for people to come through. So as soon as we hear word that they're able to reopen it for walk-ins, we will send out a press release. Absolutely.
Okay. Lizna Odhawani, who is the administration here in the Tidewater area, tremendous information on the program, benefits, how they apply to the military community. Liz, again, I know you're busy. Thank you so much for taking time out of your busy schedule to join us here on the podcast.
All right. Thank you for having me. Happy to be here anytime.
And this has been At Ease, the military podcast of Thomas Nelson Community College. For our producer extraordinaire, Jim Worthy, the guy that makes all the magic happen, I'm Gary Pounder, your host. See you again next time on At Ease.